Hola, and welcome back to the Dr. Roze Biohealth Podcast. I'm Dr. Laura, a dentist here in Dr. Roze Biohealth Clinic. I am a biological and cosmetic dentist, and I also take care of our little patients, and I will be your host today. Before I introduce my guest, I would like to remind you that if you have any questions about the podcast, please feel free to send us a message in all our social media platforms at Dr. Roze Biohealth. Welcome, Lydia. You probably remember her from a previous episode. She's a psychologist, a DHA licensed psychologist. She's from Spain and has 11 years of experience with both children and adults. She works in Kids First and Maison Santé, which is a clinic very much aligned with our values here at Dr. Roze Biohealth. Thank you for being here with us today again, Lydia, sharing all your knowledge.
Thank you for having me again.
Today, we're going to talk about a hot topic, which is dental phobia. So, Lydia, tell us, is dental phobia, what is a phobia? What is a phobia to start with?
Okay, so first, in general, a phobia is quite uncontrollable and irrational, really big fear to an object, a situation, and that's the headlines, like, okay, it's an irrational and uncontrollable fear, really high fear to a certain situation or object.
Mm-hmm. Yeah. Why do you think then dental phobia is so common? Is it common to start with?
Exactly. So I think dental phobia is not more common than other phobias when we talk about a pathology, like a really high fear about something, but it's one of the most common fears. So dental fear or dental anxiety is actually one of the most common fears and anxiety that we can find in our clinics, yes.
Okay, so it will be fear will be like less than phobia, so
exactly.
More controllable, something that you hate or you don't like, but you can kind of control with the right tools, right?
Exactly.
Okay.
So we have certain levels, and phobia will be something more pathological, like really, really high, something that you cannot control in any way. And a fear, it can be high, it can be really impact your daily basis for sure, but it's not this pathological fear.
Okay. So I see this dental fear in both kids and adults in the clinic. Mm-hmm. Do you think that kids can sense our fear and we can maybe pass on this fear to our kids?
For sure, especially if they are really little. So the little kids from newborns to, I would say it's 4, 5, 6, they just regulate emotions and fears through the parents. It's like, okay, if I got a hug from my mom and she's calmed down, I know, okay, that means I have to calm down as well. After that, after the 3, 4, 5 years, they actually learn how to regulate themselves. But yeah, when they are little, all what we have is the parents, and they mirror what they see.
Mm-hmm. I see this a lot in the clinic. Kids that, especially the little ones, they come with no expectations. Mm-hmm. They're like, okay, it's fine. But sometimes the parents are nervous and they start asking you questions and they start asking, are you gonna do an injection? Are you gonna use a needle? And I'm like, we don't talk about needles here. Like, we don't talk about we don't talk about needles or injections in the clinic. And I can feel that sometimes even they start telling the kids, don't be afraid, don't worry, you're gonna be fine. And the kids are like, why do I have to be afraid? Should I be afraid? So I think that sometimes we try to make it better and we're actually ruining the whole situation. So I would say, in my opinion, if someone is really nervous of the dentist, I always tell them not to say anything, not to interact about the dentist. Just go there, be smiling, relax, and let the dentist do the talk and the explaining and everything else. I don't know if you agree with that or not. Would you say it's something a good idea?
Yeah.
Perfect. And do you have any strategies to reduce anxiety in kids? So imagine that we already have a kid that is afraid of the dentist. What strategies can we use to reduce their fear?
Yeah, so for example, what you say, so if you know as a parent that you are a little bit anxious in the dentist, so just sitting there, try to relax, be like a stewardess, just put a smile in your face, everything is gonna be okay, and all the others will relax with you. So when your kid will be the same. So, but there is other strategies. So it depends a little bit on how old the kids are. So first strategy that I will suggest is if they're really little, then play with them a couple of days before the appointment. Pretend to be a dentist. You will be the dentist, I will be the patient, and then we will turn, you will open the mouth, you will have the sensation on the chair and all the stuff. So they got familiar with all of them. The second advice I will suggest is to be a little bit earlier to the appointment. So that means like half of an hour or an hour earlier than your appointment, because the kids are going there, and this kind of nervous climate, the anxiety around it will hit at the beginning. But if they are enough time there to just relax and get bored and know everybody, going here and there and say hello and whatever, then when they go into the real treatment, they are just relaxed and bored, and they know everybody, and it's like, okay, the anxiety level is down. It's like when you go to the ER and have to wait 4 hours to see the doctor, and you think, but I already healed. It's like
I don't have pain anymore.
Exactly. It's like, I don't have the panic attack anymore, I can go home.
Yeah.
Then that's why. So you just sit there and let enough time to relax.
Yeah, that's a good tip actually, because I've always been told in school that it was the opposite. If you have a kid, you have to bring them in straight away. Don't let them wait, because they will get more anxious as the time goes by. But it's really interesting, and it kind of makes sense, because they get used to the environment, they get to know everyone.
Exactly.
If the staff is nice to them, if they have maybe some toys to play, they can kind of, their anxiety levels can go down, and then once they go into the room, they're bored already, and they're like, okay, are you gonna do something with me or not? So that's a good idea. That's a really good tip. Any other tips for
I think in this case, so the key is to let them wait enough, because if you go there and then in 15 minutes you have to go inside, then you go inside in the peak, as you say. So if going straight away, don't have the time to get anxious, but we have to wait to the time to get anxious and then go there. Exactly. So the other things that I advise are when the treatment is already started. Like if they are really small, like 6 and 7, I don't know, 3, 2 years old, from there to 5 or 6, the best option is to explain the treatment on the parents or all the siblings. Because you have a kid, I have a kid, and we know that they just mirroring everything. So if you are eating something in your plates and they have exactly the same in their plates, they want to eat in your plate. Yeah. So they want to be sure that they are doing exactly the same that you're doing. So in this case, if you are pretend play that you will have the treatment, and the doctor can explain in the mouth of your mom, and in the mom or siblings or whatever, they will realize and say, okay, if mom can do it, I can do it.
Yeah, that's something we definitely do in the clinic. I always do it. I love when siblings come together, because there's always one brave sibling. It's not always the eldest, but there's always one brave one that wants to go straight into the chair, have the checkup done, and happy and done. So the younger sibling, then sometimes, or the eldest, the less brave one, normally looks very closely, and if everything goes well, then they suddenly are not afraid, and they want to do it. And I always encourage them to help me, maybe hold the mirror, use the air. And I think also something that works really well for them to relax is to explain everything. So show them all my instruments. Of course, I will show them in a way that they don't look scary. I will say that my instrument is an electric toothbrush. I will not say this is a turbine for drilling your teeth. Obviously not. This is an electric toothbrush to clean your teeth, and they're going to be so white. And then I show them the spray, the suction tip that is a super powerful straw, things like that. And it works really well. And also giving them the power to tell them, I always tell them, you can stop me anytime. You're the boss. So if you want to stop, if you want to take a break, if you want to close your mouth, you just let me know and we will stop. I think it's key to allow enough time with all patients, but especially with anxious patients. But yeah, so do you have any other tips for like maybe younger kids or maybe older kids?
Yeah, I think for the younger kids, that's the key for advice. And I think the older ones, the things that used to work is kind of a mindfulness training during the treatment. For sure, always do a sign or give me a sign with your hand if you want to stop. So giving the control is a great idea, not only for the older ones, but for adults as well. But with the older kids, you can give her like a game. Okay, during the treatment, you have to count around the room how many pictures you see or how many machines or whatever. So something that the mind will be focused on. And when the treatment is done, if you tell me the right number, then you will get a new book. Not sugar.
Not a lollipop in my clinic.
Exactly. You will get a new brush tooth or whatever. So you can make a game of it. So they really focus on other things. If they are really, really anxious, then you can also touch them in the legs. Like, okay, you have to tell me at the end how many times I touch your left leg and how many times the right one. So always keep the mind focused on something else that is not in your mouth.
That's actually a really good tip. We could have our nurse maybe touching them on the leg and then ask them to count and then tell me the number at the end. That's a really good tip. I'm going to definitely take that one on board. And then I feel that also something that scares a lot of people are like the noises and the smells and just overall all the clothes that we wear. In the clinic, we try to not use any disinfectants that smell of dental clinic because nowadays, thankfully, there's other disinfectants that we can use that smell like a spa, let's say. Also, we try to put some music, put something on the TV in the ceiling for them to be able to watch it. For kids, works especially well for putting some Cocomelon. I don't know what is Cocomelon about, but it's like they're obsessed with Cocomelon, even the older ones. And we also have a blanket. It's a special blanket for dental anxiety. It's a weighted blanket that helps you. It kind of feels like you're being hugged. So it helps a lot for patients that are on their own. They don't have anyone to hold their hand, and they kind of need this sensation of feeling hugged. But yeah, I think it's really helpful. I think nowadays we have a lot of advances that helps us with this anxiety, and also the fact that us as dentists are more aware of this anxiety and we understand it. I mean, my father is super scared of the dentist. So I'm really aware of how it feels. Like he has avoided going to the dentist for years, even having a daughter that is a dentist. He only goes when he's in trouble, So I understand how dental anxiety works, and I want to make sure from the young age that they have a good experience. So they never experience this pain, this fear, because when you're older is much more difficult to fight it. So in adults, do you have any different tips, or they're more or less the same?
For adults, there is other things for sure. So we cannot pretend play today's before you go to the dentist.
Maybe.
Maybe you can do. But in this case, I think the mindfulness before to go to the dentist will be great. So you just prepare yourself how to do mindfulness at that time, how to search for the environment, things that can keep your mind busy, and all the things that is not in your mouth. I think when you are in what you say, to take control, relax a lot. Like, I'm capable to do a sign with the doctor and the doctor will stop. I think that's a great thing, because to not be in control is the most anxiety situation that you can cancel.
100%.
So it's like a great thing, I think. So to relieve the pain is almost the same. So you just have to be focusing on other parts of your body. That's why when you say the blanket that hugged the kids, it's not only the feeling for hugging, but putting pressure in all the parts of your body, so your brain cannot really take all the signals. It's like, okay, I'm feeling pressure in my leg, I'm feeling pressure here, I don't know what is feeling in my other hand, so I cannot really focus on the pressure or wherever it is happening in my mouth. So that can be also helpful for the adults. So just to touch other part of your body, or just holding your hands and use, for example, one thing that we have for anxiety, that is like a pressure ring. It's a ring that is metallic, so it's like a spiky, and then you just through it through your fingers, and you can feel so like a tingle sensitive thing in your hand, that it put just your mind away from the uncomfortable things that can happen in your mouth. The other things to reduce anxiety that I think we forget is that I think in the medicine, also when you go to the dentist, we forget that the medicine are doing huge advances and develop instruments that we really didn't know in the 90s or in the 80s. So you expect the pain that you used to have as a kid, but nowadays the techniques are much different. The technology is so advanced that it's not that painful. So I used to be in the dentist a lot as a kid for my braces and all the stuff, and then I have to repeat the braces in my adulthood, and it was like a night and day. So the machines, the technology, the treatment was so not painful at all. And it was really shocking me, because I was kind of nervous. I'm not experienced the fear for the dentistry, but it was something really relief. Like, wow, that's a huge change. And I think the people forget that, also in this area of the medicines, the things change quick.
Definitely. And nowadays there's a lot of advances. We're constantly trying to find ways of making dentistry more comfortable. Even the local anesthetic, we have a painless experience. We have another podcast that talks about that with Dr. Hubert. So you can listen to our podcast talking about that as well. And we try to make the experience more comfortable. But I found really interesting what you were talking about the ring, because I find that people tend to have this, to fidget with your rings and things like that. And I remember also when I was preparing for my birthing classes, they were also talking about grabbing a comb for the hair, because it has like spikes, and it kind of is like acupressure that kind of helps you relieve pain, because you can't focus on two things at the same time. So it's really interesting. And I also find that with patients, especially when we're taking molds of the mouth, things like that, telling them to move their legs, telling them to wiggle their fingers, distracts them from what is going on in their mouth. So I think that's a really good tip. And also communication with the dentist. I always communicate with patients. I always ask them if they're anxious. But not every dentist is like that. So I would encourage every patient that is nervous to tell your dentist. Tell them that you're nervous. Tell them that you need your time. Most of the dentists won't have any problem at all with taking breaks. I don't want anyone to feel that they can't talk to their dentist.
Yeah.
I know most of the dentists are really nice dentists. They will take your time. They will allow you for breaks. They will stop when you say stop. That's one of the main fears that people have, that when you say stop, the dentist is going to continue. That is very, very unlikely to happen. I still know that it happens sometimes in some other places, but it's very unlikely, and you have to explain your fears and talk about them. And I think if you talk about them, then they kind of feel less big.
Yeah.
So yeah, I think that's a really good advice. Other thing that I found very frequently, especially in people that are anxious, is that then they feel embarrassed to go to the dentist. It's like a vicious circle. So basically, they are scared, so they neglect their mouth, and then they feel embarrassed. So on top of the fear, they don't want to go to the dentist because they think we're going to judge them and say, oh my God, this is awful. So what would you suggest for these patients to kind of overcome this embarrassment?
Okay, in this case, if you're embarrassed because, as you say, like your father, you don't go. So it's getting worse and worse and worse. So I will say, don't forget that you are the client at that moment. So the weapon about that is to be confident and say, you know what, I bring in here a challenge for my doctor. And I think that feels good in both ways. That puts you in a confident situation, like I have something that you have to face. So it's not mine. I bring you something excited. And I think it would be something excited because you don't see something that bad always, like every single day. So it's kind of exciting to have something different, something that maybe you have to do some research. Maybe you have to have a talk with your colleagues or whatever. So it is something that a doctor will take with open arms. And we forget that. So you have to remember yourself, okay, it is bad. Maybe it's not that bad that you think. But if you think it is bad, then bring this as a challenge. This person is a professional in that area, and every professional, in whatever it is, it will be happy to face new challenges. So change this mindset, I would say, and then go ahead with confidence and tell, I bring you here an awful mouth that I hope that you repair.
That's a really good mindset. I really like it because it's true. I mean, as dentists, I also like when I have a patient that comes with perfect smile and healthy mouth. I'm really happy when I see that. But I love when I have a patient that, especially when they're really scared, I'm really glad when they take this difficult first step of coming to the clinic, because I know how hard it is. And I love a challenge as well. I love when I have to ask my colleagues and work in partnership with other specialties to give the patient the best result. And it's always exciting to be able to do these things. We don't like to be doing like simple fillings every day. So it's always nice to have a challenging case, and definitely I agree 100% with you. And also I want to remind our patients that they should never be embarrassed. If anything, they should be proud. They should be proud that they did, they took the first step, which is the most difficult, and started a journey to health, to a better smile, to a better confidence. That I find that my patients completely change their personality when they improve their smile. Because of course you don't have to cover yourself anymore. You can be yourself. You can smile with an open mouth. You don't need to be like hiding. And I see them like thrive once their smile is better. So I would encourage everyone to try to fight this fear with all the techniques that you mentioned, and start the journey to a better and healthier mouth. Do you have any other tips or anything else that you would like to add to what we mentioned?
So for the embarrassment, I think the other embarrassment that we have is just to say, I'm nervous. No, it's like, that's not that expectation for an adult. But we cannot forget that dental fear is one of the most common fears that we have. So just making that like a joke and say, a little, but let your doctor know in any way that you are a little bit anxious, or maybe you are more than that. But if they just hear, okay, here is some anxiety in the room, it's okay. Then your doctor can take the control and give you the tips and ask you if you want to do this technique or the other technique, like the mindfulness, or what is your fear. Maybe it's the pain, or maybe it's the embarrassment. So we can attach this a specific fear that you have better to feel more comfortable, and then you can have a great experience at the end.
Exactly. I think to having an open conversation and open yourself to your dentist is key to feel straight away more relaxed.
Yeah.
And if you don't click with your dentist, you can always change.
Yes.
It doesn't mean that a great dentist is going to be the perfect right dentist for you. Sometimes I have patients that love me, and I'm sure there's other patients that don't click with me and prefer a different kind of approach. So don't be afraid to change dentist if you need to, and you need to feel that you can be open with them and have a conversation with them, because it's a team. So we have to both do our best to bring you to your ideal and healthy smile.
Yeah.
So that's I think we've covered a lot about this dental anxiety. Is there anything you'd like to add or?
So like the end, I will say, go to the dentist as much as you can, because you get the confrontation, and when you go like a lot, you will feel more comfortable, less anxious. The treatment won't be that big or painful because you are taking care of your mouth like regularly. So it will be a win-win in all of ways. So you do the confrontation for the anxiety, and you will have a nice smile.
I agree. I always tell my patients that if you come regularly, if you come every 6 months for your checkups, you will most likely just need a checkup and a cleaning. If you wait 3 years, then you probably will need treatment, and then it's more difficult for you to overcome. So and also I want to add that we always tend to think that our mouth is the worst. We have everything is the worst, and then also we tend to think that the experience is going to be awful, and then once we finish, it's like, oh, okay, it was not that bad in the end. Yeah. So I think...
but how awesome it is when you go just for a check, knowing that there is nothing really big to do today. You can go so relaxing. Yeah. So enjoy this experience as just a checkup. So
a relaxing checkup and a cleaning.
Exactly.
Especially when you have kids, you know that laying down for an hour is bliss. So okay, thank you so much, Lydia, for being with us today, sharing all these helpful tips. I definitely have some to take on with me to the clinic. And thank you to our listeners for tuning in with us. We hope to see you again in the next episode. And don't forget to feel good and smile.